Hello and welcome to Talk Trillium, Partnering for Patients. I'm Patty Cochran, Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which includes Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre. I'll be your host today as we take a look at how our hospital is creating a new kind of healthcare for a healthier community. And today I'm really pleased to welcome Kathy Skelly, Manager of Pediatrics at the Credit Valley Hospital.
Thank you for having me.
Welcome. So what kind of reasons are there for children to be admitted to hospital?
Pediatrics is really interesting. We're seasonal. So coming up into spring and summer, children visit our emergency department for lumps, bumps, strains, sprains, a little bit of broken bones with their activities coming into summer. During the fall and the winter seasons, we see a lot of respiratory, which would be our asthmas, pneumonias, bronchiolitis. We see a lot of gastro, which is a little bit of vomiting and diarrhea, and some focused infections around urinary tract infections. So that's what we see as our admitted population in pediatrics.
Wow, that's really interesting. So it's seasonal. And I guess parents could probably reflect on that during the spring and summer. The kids are outside, getting a lot of fresh air, and in the wintertime, I guess they're exposed to more bacteria and germs.
Close quarters together, flu season comes up. So we see a lot more of those communicable diseases in the winter.
You know, I've never thought about it that way, but it's interesting that you see that volume go up and down depending on the season. So any advice for parents in that winter time on how to protect the children and prevent them from getting sick in the winter?
So there's some really good foundations for keeping your kids healthy. Eat well, exercise. When the kids are sick, keep them home from school or from daycare. Teach them to sneeze into their elbows, wash their hands. For families, it's really important around if your child is able to get the flu vaccine, vaccinate your children, because that really helps decrease the spread of the flu during that season. And we do see that as high population of admitting for our pediatric program. So those are some really good things that we can do.
Yeah, I'll say. And I do know that, you know, having your children going into daycare, for instance, or just the school system, they do get exposed, and for a period of time, they get a lot more runny noses.
First year into preschool or daycare, or first year of kindergarten, you're going to see a lot more of cough, colds, flu, fevers within that first year. Little kids put everything into their mouths, so as much as you keep a clean environment, they're going to pick everything up.
But I understand there's evidence to suggest that it actually builds up resilience in them in their later years.
Absolutely, absolutely. Key one is around our flu vaccine.
Yes.
That changes a little bit each year, so ensuring that we've got our kids immunized keeps them safe.
And I would say the same is true for parents and grandparents, is to get their flu
Absolutely,
vaccine.
everybody should be getting their flu shot.
Great. Now, if my child is sick, how do I know whether or not just to take them to my family doctor, my pediatrician, urgent care center, or the emergency department? Is there a simple way of knowing when I need to seek help, and if I need to seek help, where to go?
One of the recommendations I would give to parents, and this was one of the recommendations that my pediatrician gave to me when I had my kids, is have the discussion early with your primary care provider. You know, when should I be bringing my child to you? When should I be bringing them to the emergency department? For simple things like cough, cold, flu, ear infections, you know, minor injuries, a walk-in clinic or your family physician is a good place to go. Emergency departments are for when kids are really sick. So when we're looking at kids that are having respiratory distress or vomiting and diarrhea, but they need to have like no tears, or they're not peeing, or they're really tired and you can't wake them up. Fevers that last for 2 or 3 days and they're not as active. Those are the times that we want to bring kids into the emergency department. But if we can find the right track to go down of urgent care or walk-in clinics, we'll really reduce our wait times in our emergency department and provide quicker access to care.
And it's such a scary thing to be a parent with a sick child at home. And you're worried that you're going to overreact, but then at the same time, you're also worried you're going to underreact.
Absolutely. So that's where some pre-planning is really important. So know your community, know where your walk-in clinics are, know what services they provide, have a conversation with your primary caregiver so that you know when that situation arises. it's not a panic moment. You've already had those discussions, conversations, you know where to go. You can always use telehealth as well as a guide to ensure that you're making the right decision and choice in that time.
So telehealth is a 24/7?
24/7, you can call in, have a conversation with a medical professional who will help you direct where your care is best provided. So they will listen to the signs and symptoms that you're telling them about your child, and based on some criteria, they'll say, you know what, you're okay to go to a walk-in clinic, you're okay to go to an urgent care, or I recommend you call 911 or take them to emergency.
Well, that's a great service to be aware of, so that there is help at the other end 24/7.
24/7.
Because oftentimes it's difficult to make that decision because you're so worried about your child. So thanks for giving us all that great advice today, Kathy. It was a real pleasure having you on the show today, and I'm sure our viewers have learned a lot. And remember, if you have any questions or concerns that you would like answered, please send us an email at talk.trillium@thp.ca. Thank you.
My name is Raman, and I work at Credit Valley Hospital on the Pediatric unit, and here we work with children ages 0 to 18 years old. I've been working at Credit Valley for just over a year and a half. Growing up, I always knew I wanted to work in pediatrics, and I was always surrounded by children, whether it was my younger siblings, my cousins, or students for after-school programs, so I think it was just a natural progression for me to end up on a pediatric unit as a nurse. Hi, Vikram. My name is Raman. I'm going to be your nurse today. Can I see your name bracelet? Okay. When is your birthday? September 8th. How old are you?
5.
5? That's a really big number. Okay, I'm going to check you this morning and see how you're doing. So I'm going to start by listening, okay? How do you feel?
Really, really good.
The best part of my job is coming to work and interacting with children of all ages and knowing how resilient they are when being taken care of. It inspires me to know that they are going through some of the most vulnerable times of their lives and they can still do it with a smile on their face. We're just going to do a little arm hug, okay? I'm going to get you to stay very, very still, tongue up. The easiest way for me to work with children of different ages has been by going into a room and finding something in common with them. Whether I'm working with a 2-year-old who likes cars or I'm working with a 15-year-old who likes Harry Potter, being able to touch base with something that we both have in common allows me to get to know them on a personal level. What are you coloring there, Bikram?
Mario?
Mario, is that your favorite hero?
Yes.
Yeah, do you like any other ones?
Luigi.
Luigi? When the older children get admitted to hospital, I always make it a point to find out what their age is and what grade they're in, whether or not they're currently in class, if they have exams going on, and what their social circle is like. So if they're not able to have those people in, we always make it a point to let them know that they can Skype them or call them, whatever they need to do to stay in touch with them and let them know that they're doing okay. Hi, B. I just wanted to clarify an order with you. I have a new order for ampicillin, 200 milligrams. We do rounds at 9 o'clock in the morning every single day with our pediatrician, our pharmacist, our dietitian, our physiotherapist, and the entire interdisciplinary team. At this point, every single child on the unit gets accounted for, and everybody is up to date with their current status. From there on, we develop a plan, and that is how we base our day regarding vitals, regarding medications, and anything else that needs to change in their plan. The most rewarding experience that I've had since working on the unit was actually working with some of our palliative patients and their families. This was something that I had very little experience with coming into this job, and I think that it was one of the most rewarding experiences for me because I was able to be there for them in the last few days and moments of their lives. 0.8. One of the most challenging aspects of my job is not knowing what you're coming into on any given shift. It is impossible to know every single diagnosis or every single thing that is going on with a patient, so I rely heavily on the interdisciplinary team and other coworkers to get me through. We work together as a team to make sure that all of our patients are cared for at the end of the day.
How old is Adriana?
There are few things more difficult for parents than to leave an ill child. At Trillium, the families are part of our caregiving team, and it is so important to us that they are able to be here around the clock to be with their loved ones.
I'm excited to be announcing today the opening of a second Ronald McDonald House Charities Toronto Family Room here at Credit Valley Hospital. The new family room in Paediatrics is a beautiful space with a beautiful view. It has a relaxing lounge area with a TV and a kitchenette stocked with beverages and snacks, open 12 hours a day. Families also have access to 3 private sleep rooms, a rest and respite room for napping, and a washroom with shower facilities around the clock.
How old are you?
3.
Like most parents, we had dreams of a perfectly healthy newborn. 6 weeks before the scheduled due date, I unexpectedly went into labor. Words cannot express how frightening it was to see our tiny, precious little newborn being placed in an incubator. The only thing that we really did know with absolute certainty is that we didn't want to leave Valentina's side. A NICU nurse soon approached us and asked if we knew about the family room that the Ronald McDonald House Charities Toronto had for our families. You cannot imagine how relieved my husband and I were when we realized that this meant we wouldn't have to leave our newborn baby. Fast forward to when Valentina was already a healthy, thriving, sassy, and incredibly energetic 1.5-year-old. And on September 22nd, my birthday, and a month earlier than the scheduled due date, I went into labor. Little Adriana Rose was born the next day and weighed 4 pounds and 12 ounces. We were fortunate enough again to use the family room. We are here today because we are so truly grateful to Ronald McDonald House Charities Toronto for making these family rooms available to us and to other parents like us.
I come from a nursing background, so for me the family rooms are just like a dream come true, and so these family rooms being such an integral part of family-centered care is vital nowadays.
So I think for Trillium Health Partners, transitioning from one Ronald McDonald room in the NICU space to 2, with one here on Pediatrics, allows the families to achieve a similar experience. I think upstairs we've seen what it means to families. I think down here we'll see very similar, that families use the space, are grateful for a place that they can come, that allows them to stay within the hospital setting, to really be part of a team. It allows them to participate in rounds, be present for those critical parts of their children's care, but also just a space where they can come and just take a break and then go back in a room and be present for their children.
Wow, isn't that neat?
The staff at Trillium Health Partners at Credit Valley Hospital site are incredible. They've been a really wonderful partner to work with from day one when we opened our first family room. They were as enthusiastic and keen as we were to open the second family room, and the support has been phenomenal.
We'd now like to welcome Esther Yang, a child life specialist at Trillium Health Partners. Welcome, Esther.
Thank you, Patty.
So what does a child life specialist do?
So my job as a child life specialist is to help infants, children, families, and adolescents cope with hospitalization and the uncertainties that a new diagnosis and their treatment brings. So my job is to reduce as much of the stress and anxiety that children often feel in hospitals. Because it can be a quite scary place for kids when they don't know what's going on and they don't know what to expect.
Yeah, it's scary for adults, never mind children.
Exactly.
And so what are some of the ways that you do that? How do you reduce the stress?
So the number one thing is children deserve and need honest information about what is to expect And often parents are the great source of that. And I always encourage parents, even when you're worried about upsetting your child about what is expected, you still want to be able to have those honest conversations so kids have the honest truth, and they know that they can lean on their parents for support. So it's preparation, talking to kids about what their diagnosis means in a child-friendly way. So I usually take the doctor lingo and translate it into a way that kids understand, right? And that allows kids to have a good understanding, and they're more likely to comply with the difficult procedures when they know why it's happening to them. And they know that the people who are taking care of them are actually on their team.
So I can imagine even taking a blood sample would be very frightening to a child. Whereas an adult, they understand that it's just one poke and it's going to be finished. So how do you actually manage that? Can you use that as an example about how you would intervene?
Yes. So I support kids with blood work all the time at Trillium Health Partners, specifically the Credit Valley site. And I do that in a number of different ways. One, whenever I know that kids are having blood work, I like to tell them about it. I do what's called medical play. Play is the language of kids. They learn everything through play. And so I have my little stuffed animal. I have the real medical equipment. We go through the steps. But most importantly, we talk about the coping strategies that we can implement during it. And we talk about how we're going to position you in the presence with your parents so that you're comforted by your parents. So we practice those before it happens, optimally. And then throughout, distraction is always amazing, and I always love when parents are involved in that part, because parents know their kids best. They know their interests, they know how they typically cope with other stressful situations at home. So distraction is really helpful, and other like pain management strategies like relaxation, and then I always tell kids, this is my little trick, I tell kids that they actually have a very important job in everything that they do in the hospital. So if it's blood work, for example, I tell a kid, you have one of the most important jobs. Your job is to stay as still as you can. And that allows a nurse or a doctor to do their job and to do your poke once if they can try to do it once, right?
Those are great lessons, even for an adult, because actually when we give childbirth, we go to prenatal classes that does exactly the same thing. So I'm not sure why I'm surprised about that. That's an excellent example. And what's your success rate then? Because it's kind of like you're setting up a game,
right?
For them to be as still as possible.
Yes.
And they can then participate in their care.
Absolutely. They feel really good about it. I get some serious kids who are very serious about the jobs and they try really hard. And throughout, they need encouragement. It's okay that you're crying. Crying is normal for kids, right? It's a way for them to express their emotions. But I say, you know what? You're doing such a great job of being as still as you can. And then you're doing amazing. It's going to be over soon.
Great.
Right? And then it's that playful attitude when you're working with kids, right? Even if you don't have, let's say, a phone to distract your kid with a video, you can play I Spy around the room. You can pretend to blow out your pain by pretending you're blowing out a set of birthday candles. There's lots of tips that parents can bring to help reduce the pain. And we know through research that distraction actually reduces pain by 50%. On top of all the other topical numbing creams and pain relief that the nurses can provide medically.
So distraction's a great thing. Any other last-minute advice for parents if their children are in hospital?
I always tell parents that they are the experts of their children. While we know how to take care of children's bodies, and we know even I know a lot of how to work with kids, but parents have the little tips and tricks of what works for their kids.
That's so true.
Yes,
isn't it?
yes. And so I say never be afraid of approaching a child life specialist or your nurse or your doctor if you're worried about how your child is coping in the hospital, or if there are any ways that we can make our medical care more child-friendly.
Well, thank you for all of those tips, Esther, and for joining us today. That was really informative.
Thank you for having me.
And remember, if you have any questions that you would like answered, please send us an email at talk.trillium@thp.ca.
question we're often asked is, does my child need a pediatrician versus a family doctor? And we will say that for healthy, well children in the community, our family doctors do a fantastic job of providing primary care and all health supervision follow-up for children in the community. Pediatricians really provide the role of consultants, which means if the family doctors have a specific question about a child's health, they'll ask the pediatrician to see a child with that specific focus in mind. If children have more medically complex issues, that's where pediatricians may provide primary care for children in the community. We would love to see all children in the community have a primary care doctor to provide their primary health needs. It's important to keep our children's immunizations up to date because in Ontario we immunize against conditions that can have significant health consequences for individual children. None of what we're immunizing for are conditions that are simple things. The outcomes can be very negative to children, and I view this as an insurance policy, and the more people who ensure their children are immunized, we're looking at protecting all the children in our community. So we can ensure our children are getting healthy diets by using some common sense. We know what foods are healthy for us to eat. We know what foods are unhealthy for us to eat. I think for adults and parents, it's providing good role modeling on eating healthy in front of our children. And I think it's using resources that we can go to, like the Canada's Food Guide, to provide us with a list of good portion sizes for children, what would be considered healthy. And the Food Guide does have a number of different ages for which you can look to see what would be considered healthy for your child. So when we think about how much playtime and downtime children are getting, one, I would say a lot of the time children will guide us. If they don't have enough downtime, they'll present as being very tired. And when we think about play can be structured. It can be as simple as families going outside and going for walks together. It can be going to a local park to just play, have our children play in the park, play together as families. Or it can be a family looking at it saying, let's identify what our children enjoy and taking them to local community centers that have activities built in for children, or putting them in formal structured sports programs where children become more active. Why is it important our children get good night's sleep? It's very important for all of us. We know that sleep's an important time where the body restores itself, where we essentially heal through sleep. And there's a lot of evidence to show the more we sleep and get consistent night's sleep, where we're not chopping and changing, we're very consistent in bedtimes and wake-up times, that children are a lot more healthy. They do better in school. They are more able to interact positively with peers. And if we had a recommendation, it would be to ensure regular bedtimes, regular wake-up times, and ensure that our children aren't sleep deprived, because that has significant consequences for them when it comes to achieving their optimal health goals. Have multiple screens that connect us to the world, and when we think about screen time encompasses TV, cell phones, laptops, all computer devices, and we know that the more sedentary we are, the greater risk we have in children of seeing children who are overweight and obese. And when we think about the health consequences of being overweight or obese, they relate to type 2 diabetes risk, early onset of heart disease risks. And we definitely know that disconnecting from devices can be a challenge, but I think children also model what they see. So it's very important that the adults in children's lives are good role models when it comes to screen time use. It's our ability to disconnect during important times with family, so around meal times, for example. It's a very healthy rule to say, put our cell phones away and be able to sit down and have discussions about what constitutes health in our family.
There have been recent outbreaks of mumps and measles in Canada, and public health officials are urging us to make sure our vaccines are up to date so we can protect ourselves and the community. How do you know if you and your family have up-to-date immunizations? In Canada, vaccines are the responsibility of the province, so each province has a slightly different schedule they recommend. While some provinces are starting to monitor immunizations electronically, vaccines are still tracked using a vaccine booklet that you are responsible for maintaining for yourself and your children. There are some new apps available, like Can Immunize, that can help you track your family's immunizations digitally. But the current process is that parents are given a vaccination record and schedule at their child's first appointment. This should be kept carefully, brought to each doctor's appointment, and be updated with each vaccine. Vaccines are administered by public health, family doctors, and schools. You can find the recommended vaccine schedule on the Government of Canada website or through your local public health unit. If you've moved provinces, check to make sure you haven't missed any vaccine doses or boosters. If you've lost your vaccine record, you can try to contact your previous care providers, school, or public health agency to see if they have a copy. Your doctor can sometimes order blood tests to check your immunity levels if records can't be recovered. Measles and mumps are highly contagious viruses that are resurfacing in our communities. To ensure you and your family are fully protected, it's important to know if you've had the MMR, measles, mumps, rubella, vaccine and booster. Since the mid-1990s, we have recommended 2 doses of the MMR vaccine. Children in Ontario get a dose at 12 months and another at age 4 to 6. But if you are an adult born before the mid-1990s, you might be missing a dose of MMR and might not be fully protected. Please check with your healthcare provider to ensure you are caught up.
Thank you for watching Talk Trillium. See you next time.